So the term regression basically means that there's loss of a particular skill that was previously present. So the child has acquired a skill, and because of some complication that we may or may not be able to pick up at this point in time, the child goes into a developmental regression. So there is a loss of acquired skills that we usually see in the child. Now, this is very common when it comes to children with autism. The prevalence rates in those with autism seem to be about 1 in 44 to 100, which is like about 1/3 of children with autism. At some point, definitely, parents are able to identify or report a history of regression. A lot of times, children who have seizures, epileptic encephalopathy, and other severe forms of seizure disorders can also have regression. Even though very mild, there could be other important causes of regression, which could be something like prolonged hospitalization. It could be related to chronic disorders, autoimmune disorders, childhood cancers, where children are treated and admitted for prolonged periods of time, which could sometimes cause loss of acquired skills, that is regression. Until now, in research, not a lot of studies are there which have given a specific definition and surely giving us a guidelines towards what exactly comes under this large umbrella of regression. But I think it's also important to understand that there are no tools which we can use specifically to screen or evaluate or investigate and say, yes, this child has definitely had regression of milestones. It's also very, very difficult for the caregivers when the child has regression, because it definitely takes a toll on their emotional aspects, on their physical aspects, on their mental health, because it's quite a stressful situation to see that your child lost some skills which they had, even if it's a child with autism or a developmental problem. But it's very important and essential to get your child investigated as soon as possible if at all you detect that the child has regression. So regression is a red flag. Please do not miss it. If you think that your child who previously had some skills lost those acquired skills, then immediately go to your healthcare provider, seek consultation, get your child evaluated, because a lot of times it can be reversed if picked up very early and treated very early if they find a cause. So don't neglect it and help your child as soon as you can.